Hello, welcome to our Facebook live streaming all over the world from the Latin Chamber of Commerce. We're so grateful to be here today. We are here today with Consumers for Quality, and we're going to get started with some incredible guests for a welcome. Today we have Jim Manley from Consumers for Quality. We have Mark Melman, President and CEO of the Melman Group. Of course, State Senator Joe Hardy. We have Denisha Mingo, CEO and Director, MHS Behavior Services, and Stephanie Riska Kennedy, who is a patient advocate. And so at this time, I want to welcome all of you. I want to thank you for being here with us, spending your afternoon with us. I want to turn it over to Jim Hanley, who will give us an overview of Consumers for Quality Care. Jim, if you can hear us, you're on.
Thanks, Peter. Hello, everyone. Let me first of all say that on behalf of my fellow CQC co-chairs, I'm pleased to welcome everyone to today's roundtable discussion with the Latin Chamber of Commerce. Consumers for Quality Care is a coalition of patient and healthcare advocates and former policymakers working together to lift the voices of patients as they demand access to high-quality, affordable healthcare. I'd like to thank everyone for joining us this afternoon to share their insights on this critical topic. As Peter mentioned, we will share findings from new research today by CQC in collaboration with ALG Research and the Melman Group on the quality of healthcare access and affordability in Nevada. As you may or may not know, I was honored to work for Senator Reid as his communications advisor for many years. And as such, I'm excited to be here with you to discuss the real life impacts of rising out-of-pocket costs and how we can motivate our leaders to carefully apply fixes to these issues, particularly as we continue to grapple with the impacts of the COVID-19 pandemic. And so I'm delighted to introduce Mark Melman this afternoon. As some of you may or may not know, Senator Reid really, truly does not, I don't know if it's fair to say but he doesn't trust pollsters, never has, never will. I won't bother you with the details, but it's just a fact. He never trusted them. However, he did make an exception for Mark Melman. And the proof was in the pudding. In 2010, a lot of people were saying Reid was down and out. Mark kept on telling him he was going to win it, and lo and behold, he did. And so for that, I'm always grateful. And so for what it's worth, the Senator Reid, who I talked to last week, and as usual, was bragging about all the construction going on in downtown Vegas. So with that, Peter, I think I'm going to kick it over to the world's best pollster, Mark Melman.
Hey, Mark, we appreciate you being here, and we look forward to listening from you.
Jim is a good and dear friend, and working for Senator Reid is really one of the greatest honors of my career. And so I'm just delighted to be with you. I'm sorry I'm not with you physically in Nevada, but delighted to be with you in spirit and delighted to be participating in this work for Consumers for Quality Care with ALG Research in this Nevada poll. Let me start with some of the key findings out of the research we did. I'll talk for a second about the methodology, then we'll go back through some of the detailed data. But Nevadans have a very simple, big problem with healthcare, and that it's too expensive. Voters think that healthcare costs are continuing to rise, create an environment where even with those who have insurance aren't sure what their costs will be, and even they with insurance struggle to pay their bills. The result, over a quarter of all Nevada voters, including almost half of those struggling financially, have either unpaid or overdue medical bills. So voters want elected officials to get these costs down, but not at the expense of access to quality care. Voters are especially concerned about out-of-pocket costs like surprise bills, high deductibles, delayed health care because of rising health care costs. They also believe that having good health care means having access to quality providers. And again, they do not want to compromise on the quality of their health care to hold down costs. Voters don't want dramatic changes while the healthcare system is stressed from COVID-19. Very few are clamoring for a fully government-run system. 71% of voters agree we should be cautious about making changes to the healthcare system while it's still stressed coming out of COVID-19. Most people believe we should build on the system we have through targeted fixes. So with that in mind, just to give you an indication of the methodology that we employed here, the Melman Group and ALG Research conducted an online survey of registered voters in Nevada, 600 total respondents. The results were weighted to reflect the composition of registered voters across the states. The interviewing for this survey was conducted at the end of July, the 19th through the 25th. So just to give you a sense of how people think about healthcare overall, we asked for a word or phrase, open-ended, that comes to mind when folks thought about the quality of healthcare in Nevada. The dominant answer, the size of these answers reflects the number of people who responded in that way. The two biggest answers are very clear. One is that it's good, and the other is that it's expensive. So people are concerned about expense, though they do think the quality of healthcare in Nevada is good. At the same time, 39% of voters think they might have to leave the state to get quality care if they became ill. Only 44% overall are confident that if they became ill with almost any disease, they could get quality care that they needed in Nevada. So again, a plurality are saying, yes, I could get quality care no matter what I became ill with in Nevada. But a hefty minority, 39%, are saying, you know what, I might well have to go out of state. And if we look at people who have serious health issues, who tell us in the survey that they're suffering from serious health issues, they're evenly divided between those who feel confident that they could get care in Nevada and those who believe that they might have to go out of state to get the quality of care that they need. Voters overwhelmingly believe that the cost of health care is rising faster than their own income. We asked people which they thought was going up faster, the cost of health care or their income, or whether both were going at the same rate. 71% of voters overall, 76% of those struggling financially said the cost of health care was going up faster than their incomes, So again, over 70% saying that the cost of health care in Nevada is going up faster than their incomes for folks in Nevada. There's also a great deal of concern about rising costs and unaffordable bills. People were asked whether they agreed or disagreed that the amount they pay for healthcare seems to be going up every year. 75%, 3/4 said yes, the amount I pay for healthcare is going up every year. Only 16% said no. And 62% told us that at some point in their lives, they struggled to pay a medical bill even while they had health insurance. So again, 62%, even while they had health insurance, struggled to pay a medical bill. 35% said no, they really hadn't struggled to pay medical bills. Obviously, that 35% is a distinct minority. People are worried about cost-related expenses with respect to healthcare. So we asked people how concerned they were about various kinds of problems related to healthcare. 73% expressed at least some concern with getting a surprise medical bill that is thousands of dollars. 71% were concerned that they'd be unable to afford a high deductible for care when they needed it. 66% said they were concerned about needing to delay care because of high healthcare costs. Almost 6 out of 10, 59% say that they are concerned that they may be unable to afford their monthly healthcare premium. So a great deal of concern expressed about health-related expenses. And in fact, the current situation leaves a large number of people with some unpaid bill. Overall, 27% of Nevada voters say they currently today have an unpaid or overdue medical bill from a provider, a hospital, lab, or other healthcare service that they're finding difficult to pay off. So more than a quarter already having difficulty paying off some medical bill. Among people of color, that number rises to 33%. People of color, 33% saying that they have currently unpaid or overdue bill that's difficult to pay in the medical field. And among those who are struggling financially, 50% of those people struggling financially have an overdue bill, an unpaid bill from a healthcare service that they are finding it difficult to pay off. So what about solutions to these problems? Well, we gave people two choices. or they thought Congress should focus more on building on the current system by making specific fixes, such as reducing out-of-pocket costs. 59% took that view. 27% said they want Congress to focus more on fundamentally transforming the healthcare system. So again, by 59 to 27, a 32-point margin, people are saying build on the existing system by making specific fixes. Democrats believe that as well by 53 to 40, a 13-point margin. Independents overwhelmingly believe that by a 28-point margin. And Republicans by 55-point margin say build on the current system by making fixes rather than fundamentally transform the healthcare system. We asked people what they wanted elected officials to work on the most. Reducing the cost of healthcare came out at the top of that list. 40% said reducing the cost of healthcare was the most important thing they wanted to see their officials work on with respect to healthcare in Nevada. Improving quality of care came in next at 17%, followed by increasing access to coverage at 17%, and simplifying the system to make it easier, 12%, said that was the most important aspect of the system for elected officials to agree on. If we look at what would align with people's priorities across party lines, it would lower deductibles, prevent insurance companies from selling junk plans. 92% strongly agree, 92% agree, 64% strongly agree that insurance deductibles should be low enough that they don't get in the way of getting the health care you need. 87% agree that insurance companies should not be allowed to sell plans that cover so little that going to the doctor is not affordable. So 92% say deductibles should be low enough to not get in the way of getting health care you need. 87% do not want insurance companies selling plans that cover too little. About 64% strongly agree with those points of view. The number who disagree is really in the low single digits on both of those dimensions. So let me stop there and turn it back to our
So you just heard, I'm sure that Nevadans overwhelmingly believe that healthcare costs are too high. They're just too high, and we need to figure all that out. And so, just honored now to transition to a great friend of this chamber, a great friend of mine, Senator Hardy. Could you please share with us what was discussed in this past legislative session regarding healthcare costs? And would also love to have your perspective as a physician.
I'd love, you asked me to talk, Peter, so hey.
Let's do it.
I've got an open mic.
You got an open mic?
All right. A lot of what we did was talk about health, not just the cost, but the quality and the access. So when we start talking about access to care, it means that somebody has to be able to get the care, somebody has to give the care, somebody has to pay for the care, somebody has to be there to pick up the pieces. Those are called hospitals and emergency rooms. And it has been a fascinating session because all of the things that we discussed. One of the things that I think we will have another bite at an apple is the copay accumulators. I had a very simple bill that said if you didn't want to receive your medicines by mail, you could say, I don't want to receive them by mail, I want to pick them up. So that started out very simple, and then it kind of blossomed, and other people will probably talk about copay accumulators, but bottom line is when somebody has a insurance that they don't get to count the rebate or the discount that they got as part of their co-pays or part of their total expenses that they incurred, then it comes back to bite them at the end where they have to pay a lot of money. So the simple bill became a little more complicated, and in that process of becoming more complicated, it failed. We legislators like to do things that are straightforward, simple, so that even I can understand them. And so it was one of those that was, it'll be back in 2 years. And we kind of think in a long-term view of 2 years is not very long. But for those people that don't have the money to pay for the bill today, it's a long time.
It's an eternity.
And, you know, if you don't got it, you don't got it, and then you feel, you know, a lot of stress. So one of the things that we did is we did a lot of different things in small ways that were very critical. And I just made a list. For instance, nationwide, we're going to have a suicide hotline. We're going to have that in Nevada, so you can call 988. Right now, if you call 988, it won't work because it's not online, but I tell people call 211, and 211 will be able to tell you how to get to anything. And 211 is an invaluable tool, but when you're in the throes of worry and depression and anxiety, 988 is going to be a very good thing for us to be able to have in Nevada. So likewise, in the abilities to do behavioral health, mental health, we addressed a lot of things. You know, we can now have mobile crisis units, or mobile crisis teams. We can have hospitals, regular hospitals, become a crisis center for mental health. It used to be when you went into an emergency room in Las Vegas, you saw 3 gurneys in the hall. That was called our crisis unit. It's not acceptable. So we are now doing something that's more patient-centered, patient-friendly, person-friendly, and I'd even say person-friendly, because if we start defining people as patients, sometimes it takes away some of their humanity. Every one of those people is a person. And we looked at things that were very simple, like doulas, people who will be able to help a pregnant woman through the pregnancy, through the labor, after care, nursing help. Doulas are going to be invaluable, and we're going to pay for it. You know, everything comes down to pay sometimes. But doctors, we know that we don't have enough doctors in Nevada. We don't have enough nurses. We don't have enough PAs. What are we going to do? Well, we did something very practical. We said pharmacists will be able to give a prescription for a birth control pill, for instance. They'll have a criteria that they check to make sure it's safe, and they will literally be able to dispense birth control pills to a person without having to wait for a doctor's appointment. And oh, when you're waiting for a doctor's appointment, and we don't have enough doctors, did I say that already, Peter?
You did.
We don't have enough doctors. And so one of the things I deal with is people call me up and they say, Dr. Hardy, who's a good doctor that I can see? And the problem is we have a lot of good doctors who aren't accepting new patients. And that's really one of the bottlenecks that we have, is what are we going to do to get more doctors? People with kids who have autism, for instance, we bumped up the pay for people who treat autism. We put an investment in that. We looked at all sorts of things that would help somebody soon, as well as in 2026, we'll be able to, if the clouds and the stars are all aligned, be able to have a public option, and that's for an insurance that will be available to more people. So it's a little disingenuous to say we have it, because we don't have it yet, but we talked about it. One of the things that I did, and Assemblyman, the Speaker, had the same bill, was to make sure that people who are incarcerated come out of incarceration with their Medicaid intact. So if they were in a prison or a jail, their Medicaid is terminated now, and we said we don't want it terminated, we want it suspended. So when you suspend it, as soon as you walk out, it's okay again. If, as opposed to a termination, that's a month or months before you get your Medicaid back. Prisoners sometimes, perish the thought, have substance use disorders. And they need to be treated while they're incarcerated, and they need to be treated as soon as they get out. If you're incarcerated, you are in a forced withdrawal state. As soon as you get out, you say, well, I'm going to go use, and you use at the same dose that you left off with, and that is a very vulnerable place to have death with an overdose. So those are very simple things that will make a huge benefit for people who have particular problems that we've had in Nevada. And, you know, from a family doctor standpoint, I'm a family doc. One of the things that I actually get tears this last session when we did not aggressively look at our vulnerable populations and go out and get them vaccinated. For me, that was a tragedy that we did not involve the faith-based organizations.
That's right.
We did not go out and get them where they're at. And I think we have lost people because we didn't use the people who can interact with people who are vulnerable. And I think that was a tragedy that we missed. And I hope that we can correct that, but you know, that's water under the bridge, and we need to go on. Am I going too long?
No, you're doing great, and certainly saying some things that are very powerful and need to be said, so thank you.
One of the challenges that we have is we don't have enough doctors. Did I say that yet?
A couple times, but
Okay.
keep saying it.
Okay. Don't have enough doctors, don't have enough nurses, don't have enough, fill in the blank.
Yep.
So one of the challenges is the doctor of today wants to be hired by somebody instead of put her shingle out. And right now, when you come to Nevada, who's going to hire you? So there's a network of people that the insurance company, for instance, contracts with, and TikTok, the gate's locked, nobody else can play. So if they come to Nevada, they have